I think primary care has a really pivotal role in the assessment and the management and the treatment of people with dementia. I sometimes use the analogy of diabetes. When I qualified a number of years ago, I know that diabetes was a condition that was managed in secondary care in hospitals, and now most of diabetes is assessed and managed in primary care. And I think looking at the way that primary care deals with people with dementia, manages and supports people with dementia and their families is important. We need to make sure that colleagues in primary care have the skills, have the confidence to manage people. And I think that's something that we're working very hard towards, but kind of breaking down some of the barriers, I think, between primary care and memory services would be really important, and there are very good examples across the country. In terms of the national work that we are doing in dementia, I think for me it was important with the National Dementia Strategy published in 2009. We had the Prime Minister's first Dementia Challenge in 2012, and then in February of this year, 2015, we had the second Prime Minister's Dementia Challenge, looking specifically at taking things forward to 2020. I think that set a number of very important parameters in terms of a timely diagnosis of dementia, supporting people with dementia, looking at areas of awareness and the stigma of dementia, and the importance of research.
It's really an important contribution that speech and language therapists have to make to the multidisciplinary team to support individuals to stay at home for as long as possible. People who are living with dementia are very likely to become much more confused if they go into hospital. And once they're in hospital, then it can be quite difficult to get people back home again. In Powys, we have been developing our therapy strategy, and one of the top messages for speech and language therapists is to be involved much earlier on when people are diagnosed with dementia.
Speech and language therapists are doing an awful lot to actually improve the outcomes of people with dementia. And that includes being there at sort of the early to middle stage, in which it enables people to stay at home or stay within their placement for as long as possible. You know, if you've got people there who are supported and trained by a speech and language therapist, they then understand the communication impact and the breakdown that can occur when, you know, the cognitive processes are affecting communication. And when they affect communication, what happens is that placements can break down, you need higher packages of care, you need more expensive places to put people, or they're admitted to an acute psychiatric unit for behavioural problems. And I think it's really key to involve speech and language therapists as early as possible to avoid that.
Speech and language therapists are skilled at actually identifying swallowing problems, avoiding chest infections, helping maintain social contacts, and these are all issues that are going to actually mean that the person can stay at home They perhaps avoid an acute hospital admission with a chest infection. They maintain a good nutritional intake, and so they don't lose weight. They maintain good relationships with other members of the family, and communications are better, and so there isn't social breakdown. And this means that the expensive aspects of dementia care, which is hospital admissions and paying for nursing home residential cares, are avoided or are delayed, and that's a very large cost saving.
I think looking specifically at that post-diagnostic support, at looking at the way in which we support people with dementia after a diagnosis, I think is very important, and I think there's still a lot of work that we can do with that. I think also the issue of risk reduction of dementia is key, and looking at things that we can do as individuals to reduce our risk of dementia, and there's emerging evidence that that's something that it can be quite effective. And then looking at and towards end-of-life care and looking after people in the later stages of dementia. So I think my ambition, if you were to ask me what my specific ambition, it would be to make sure that dementia is centre stage, that everyone who is thinking about services has dementia there. And as someone said to me, the secret is to have people still talking about dementia when you've left the room. And I think some of the things that we're doing are very powerful in that regard.